have Governor Wesley Rotich from Elgeyo Marakwet, him who is spearheading ICT at the Council of Governors. Also, we have PS, Medical Service and Professional Standards, Mary Mudhoni. We have the attendance of Olive Mogenda, who has been a pioneer in the creation of the Kenyatta Universal University Teaching and Research and Referral Hospital. And just right about now, just taking a look at some of the stands that are here at the Kapkatet grounds. Remember that today the theme of day 2 of this conference is digital health innovations and solutions. How far are we coming as a country in terms of ensuring that we deliver the universal health coverage through digitization? How did we get to digitization? What is our journey looking like? Because taking on such a task is really not as easy. It needs a lot of financial resource allocation and input. And with this, we are looking at the story of Kenyan health data in terms of, record keeping and digitization. Today we have also seen how we have evolved, going from paper. We have had exhibitors saying that, for instance, during birth, a child would probably be taken, data will be taken and you're given a birth notification. But now with this system, it means data will be taken. Yes, you will be given a notification. But now the Ministry of Health will be able to track this child as they grow, as they continue to grow. They can be able to take these records and see how, and evolve as the child grows, how they are faring on. This all will be, able to be will be taken to ensure that the healthcare of Kenyans at the community level is prioritized. We are looking at what is the benefits of digitization. Some of the benefits that have been mentioned is that there will be able to be proper stock taking of some of the medical resources that we see in our hospitals. In terms of, is it the medicine? When you go to hospital, will you be getting this medication? What about the expired medication? What happens to those medication? We'll be having to look at some of the equipment, stock taking, just how many equipment are functional, how many are not functional. And then there also is another advantage, which they say that one other benefit of this system is that a patient's record will be, taken right from birth to death, meaning that whatever happens to that patient, they can be able to track it and ensure that the records are well kept. And just not in some of the phases, some of the counties that have been taken to be in the pilot projects, but also this project is expected to be phased towards the entire country. We are looking at the Kenya Medical Teaching KMTC tent, where we are seeing students who have really put up their exhibitions and looking at what they're learning in class. And as you know, this is the future generation of some of our nurses and doctors, and so we're looking at what are they learning, how are they using technology in terms of in their day-to-day class activities, and ensuring that they are probably putting it to paper. It's not just about talking about digital. What are they doing in class about it? We will see how, as we continue, how the digitization of the health ecosystem is ongoing in the country. Right about now, we are looking at the PS ICT, taking a look at the Triba-U, which is an EMR system that ensures the patient journey is able to be seen. And we will be looking at how we can power, patient and primary health care through networks. This is the second day of the pre-conference that is happening on the UHC, the Universal Healthcare Coverage, here in Kapkatet grounds at Kericho County. We are looking at today the digitization of the healthcare system. The chief guest would have been Cabinet Secretary, Ministry of ICT, accompanied by Cabinet Secretary, Ministry of Industrialization and Trade, and also His Excellency the Governor, Elgeyo Marakwet, Wesley Rotich. And we have had, before this session, we have had a plenary where we have seen the patient's journey and the perspective of a healthcare provider. We are live with an official from KMTC. Probably, what is your institution doing as we go digital? How are you equipping your learners to ensure that they embrace digital?
I'm called Josiah Cheriot, KMTC chairperson. As KMTC, we are aligning ourselves to Kenya Kwanza objectives, and as we go along, we are starting to engage ourselves from the lecture halls, students to understand what is happening in terms of digitalization of activities, even at the community level. That's why we are having our staff training the people at the cadre level, the lower level, so that they can also engage the community to understand what's supposed to be happening. So we are in it. We are working together with the government to actualize the creation of the Kenya Kwanza government. And
we are looking at your exhibition here. Probably just give us a brief. What have you exhibited for us?
We have several programs. I wish you could go around. We have physiotherapy, we have nutrition. We have all the programs that we are offering at KMTC. I don't know whether you'll get time. We walk around so that you can see physically what's happening.
Yes,
let's start from here. So kindly let me ask my colleague, Ms. Koech, to take us through the technical part of it. Thank you.
Thank you. Here, this is Kenya Medical Training College. We are showing how we manage fractures using skin traction. If somebody has a road accident and has a broken limb or motorcycle and they have broken limb, when they are referred to the hospital, this is when now we come and reduce the fracture by immobilizing that limb, and we do skin traction, and then we maintain alignment so that now the fracture has been fixed and put in the same position until when it has united, the bone has reunited again.
Okay, let's have a quick round, a quick one, so that we can have an overview of what is happening.
Now, in case you lose your limb in a road traffic accident, after we manage you, and then maybe there's a complication and your leg is cut, then now, later on when you are okay, we give you a limb so that you are able to function again. So we offer prosthesis, and this is made at Kenya Medical Training College.
Thank you. Probably one question that we are getting as even we continue the exhibition, how different is the training then and now?
There's a difference because now we are aligning with the modern technology. As the technology improves, even as we are improving in our teaching, because even we can teach virtually using the e-learning, and we can also incorporate the face-to-face classes. So we have virtual classes, and we are also having modern laboratories where we are able to teach our students, demonstrate to them to manage and practice in the lab before they go to the actual patient. By the time they are going there, they are perfect.
Okay, let's continue moving along. We see that the students do have a lot in exhibition. Probably what is going on here? We are looking at this. What is this?
What is going on here is that in case of an accident, there are those ones who may lose their breath and they are not able to breathe. So we are able to do CPR, we are able to do first aid and bring that person back to breathe. And if he's not able to breathe by doing the CPR, then now we go to intubation. We intubate and we monitor with the machine to see that the breathing has been established for a patient to be able to be managed well. Yes.
And probably as we continue, as my camera person just shows you what these students here have exhibited for us, we are at the dental